Thank you very much,
Thank you.
Tracy. Good afternoon, everybody. Bonjour. Il nous fait
We are happy to be presenting our project called Health Needs of the Elders of the Madawaska Maliseet First Nation. This is an interdisciplinary project that I'm co-directing with my partner, Micheline Plante. So the presentation will be done by both of us. This presentation talks about the evolution of our project to this day, from its design stage to implementation, and it's currently being carried out. This is, we have received a grant from Healthy Seniors Pilot Project, which is connected with Health Canada and the Department of Social Development in New Brunswick. We also have support from SRAP for the statistical aspect of the program. So to begin with, I'm going to give you a bit of context about our study. As you know, New Brunswick is the only officially bilingual province in the country. Now, if we look at the population, 2/3 of New Brunswickers are English speaking and 1/3 is French speaking. There are 15 First Nations communities within the province. So the Mi'kmaq communities are along the coast, the Atlantic coast, and then there are the Wolastoqey communities and Maliseet communities that border the St. John River. So our study deals with a small community of 375 citizens located in the northwestern region of the country. There's about 375 citizens, as I said. 15% of those are over the age of 55. So there are three major challenges facing this community. So one is its small size. Second, the presence of two official languages, both official languages in the community itself, and then its distance from the urban centers in the province. So elders have to travel throughout the province if they need specialized services, because those services are not available in their region. So either St. John, Fredericton, or Moncton, that's where they have to travel. And often, these seniors also have to go outside of the province and go to the province of Quebec for certain specialized care. So where did this idea come from? Well, there is a growing increase in demands for specialized care outside the region, elsewhere in the province, and even outside the province. There's also a language barrier, the aging population. There's a variety of transportation need for health appointments, such as going to the doctors, going for diagnostic tests, seeing the optometrist, the pharmacist, and so forth. There's a decreasing number of informal caregivers, and there was a funding opportunity that was offered, and there was a partner group that was set up as well. So what we did was we did a literature review to see if there were situations that were similar to what we had in New Brunswick. So we found in the research that there is a growth in the number of Indigenous people aged 65 and over in Canada. We also noted that there is an increase, a quite substantial increase in chronic diseases among Indigenous populations. There's a prolonged recovery period among First Nations. And there are various reasons for that. One, the distance, which limits access to healthcare and services, so that's a challenge. There is extended waiting times as well, which causes problems in terms of access. There's a decline of informal caregivers, and social isolation. And there's a limited access to resources in their language. So more and more elders are using technology to learn about health and specialized programs to improve their health. And there are also more healthcare professionals that are recommending specialized programs on tablets to allow people to access rehabilitation services, language services, exercises to improve their cognitive abilities and their memory as well. And there's also, in the literature, talks about the importance of involving people and to respect their traditions and cultural practices. So here's the aim of our project. What we wanted to do was reduce barriers to access to healthcare and services by using a mobile application that was placed on an electronic tablet, and that tablet was connected to the community health center. So there were 3 phases: pre-implementation, to implementation, and then the evaluation phase. The targeted objectives for the first phase were 1, to identify the health needs of MMFN elders living at home. Secondly, we wanted to develop initiatives aimed at responding to the identified needs. And then the third objective was to train elders to use technology to request their services that would specifically address their needs. So here's the methodology we used in this study. We wanted a participatory approach involving a mixed estimate. So there was a mix between quantitative and qualitative approaches. So before we implemented the study, there were 5 steps. We wanted to conduct data collection to identify the priority needs. And then we would use those needs to develop the platforms. And then we would put those services on an application or on a tablet. Now, given the language duality in the community, the application had to be available in both official languages. Elders were then asked, or they then received a personalized invitation from the community center. And to participate, people had to be 55 years of older. They had to be able to speak or understand English or French, and they had to be able to answer questions. Now, for our needs, we hired a research assistant who was from outside the community. It was important for us that participants feel comfortable to speak. So that assistant was hired and trained to conduct a semi-structured home interview of the 35 study participants. So here's a few of the results that were most interesting to us. So 66% of our participants were women, 34 were men. Over half of our participants were over the age of 65. 57% of participants lived in houses or homes with 2 or more people. So they could be living with brothers, sisters, and so forth. And 26% of the participants were caregivers for other people around them. So that person could be living in the same household, but a number of them were living with their fathers, their mothers, neighbors, and so forth. Another interesting result is that 23% of the people depended on other people for driving them to appointments. 31% could not leave their home for various reasons, health conditions, weakness, and so forth. A third of the participants were already using either a tablet or a community computer to communicate, and 94% felt safe at home and wanted to stay at home. Now we distributed a survey on health status, and here is some of the results. There were 9 dimensions, if you will, or 9 themes. So a lower score indicates a poorer condition of health. So the lowest scores were in terms of energy and fatigue level, changes in health status, and the limitation of roles due to physical problems. That's where the lowest averages were found. We identified the interviews and we analyzed the interviews and identified the following needs and proposed situations. So some people need transportation within the region, outside the province, but also outside the province. People also talked about the need to be accompanied when they were traveling. So people with mobility issues, for example. People also felt the need to be accompanied. They didn't want to be alone during their appointments. The language barrier was another important issue. People talked also about the burden of giving care at home. So there was a need for home-based respite services. Access to health services was another theme that came up. People wanted better access to healthcare services outside of office hours. In the community, there is a healthcare center, but its hours are limited. People also mentioned the need for help at home to run errands or to do small jobs. Shopping was also a need. And technology training as well. People felt limited in their ability to use technology. Now, remember, last year we were in full lockdown, so a number of participants mentioned that a greater need for social activities, whether to do crafts or to do music, to take cooking workshops and so forth. So there were lots of ideas that served as a basis for our initiative. So on the technical aspects, we wanted to address the three top needs of elders. So providing a transportation service. We wanted to give them help to get to the hospital, going to see the optometrist, the dentists, the physicians, and so forth. So we wanted to provide them in support. Now, the person providing transportation services would also be able to provide a certain amount of accompaniment. Home services as well. And then we added another level of service, which we called other requests. So for example, going to get groceries and other tasks like that. We hired a company to develop a mobile application, and then we bought electronic tablets. All right, so here are some of the communication and distance issues that we had. Because this is geared to elders, the information has to be available in both official languages. And there had to be simple language, it had to be clear. There needed to be a combination of images, symbols, and text. Instructions were presented on each page. And in this application that we developed, the button lights up when you pressed send so that they can see it. The elder receives a confirmation message that their request has been received, and then there's a follow-up call from an employee. And there's also a tutorial that's always available in the help tab, as well as a hard copy, which was distributed to seniors. Now, operationally speaking, we had to create a new position within the community worker team, and we called them an overall health assistant. So we had to train that person It had to be somebody that the community would trust as well. It had to be a mature individual, patient, and somebody who could think on their feet. Somebody who also worked well with seniors, and somebody who had a good driving record. And so we were able to find that person. That the person we hired had to obtain a Class 4 driver's license. They also had to take training in in informatics. And this individual also had to learn how to use the application. So the participants and the assistants had 2 weeks to test the application, and it was a time as well that we used to settle any minor issues that arose. So the person officially started their position on October 12th, 2020. So as we see, the number of requests varied per month. And it probably had something to do with the succession of phases that the province was going from. We went from red to green phase and then so forth. There was also, so in December 2020, 12 of the 35 participants were making requests, so 60, but that number increased in September. And this increase showed an increasing interest in the initiative by the participants. So the nature of requests, what we see here is the breakdown of the different types of requests that were received. So there was traveling to the doctors, foot care was a common need. Hospital travel began in May. Translation as well, and travel within and outside the province. Travel needs increased. And so this gives us an idea how important it is for members of the community to have a service both within the province and outside the province. And as an Indigenous person myself, I can tell you that it really is an advantage for our community. We also had to add new services throughout the project. So telephone follow-up and friendly visits were added. We wanted to ensure a certain level of safety. And then we added equipment loans in May following requests by the participants. The level of appreciation remained very high since the beginning of the project. Seniors in general were very pleased with the services. The purchase of an adapted vehicle by chief and council demonstrates the importance given to the well-being of seniors in the community, as well as a lasting community, or lasting commitment rather, to the future of the project. So over the last year, 3 of the elders passed away, and then 4 new people signed on to the project. And currently, there are 16 participants that are registered, and 28 tablets have been distributed. 67% of participants use technology to request the services. And the assistant always follows up by telephone and helps interpreters complete their requests. Now, because of the pandemic, it it's been difficult to promote the project. So there is still work to be done in that regard. Now, the pandemic in the Northwest has slowed down our promotional efforts. And we haven't been able to offer as many webinars as we would have liked to.